Hi, this is custom holistic testing and analysis for patient number 01225. I'm Dr. Jim Carlson from Grove Animal Hospital and Holistic Center. We're going to go over this analysis in detail for you today. If we think about this patient had a history of itching and allergies, which had been cropping up from time to time. And so as far as where we are right now, we had weak circulation, weak skin, weak endocrine, and weak lymphatics. And if we think about how that goes together, the endocrine system controls circulation, and circulation controls lymphatics. And lymphatics are the liquid that moves through the body that takes waste out of the body. And if it's not moving correctly, the skin is going to become inflamed because the immune system reacts to it. And if the immune system reacts to it, then we're going to get inflammation and various symptoms. In this case, the patient is itching and scratching, some discomfort. And so what we need to do is, first of all, get this patient comfortable again. So we're going to use a little bit of anti-inflammatory to reduce the symptoms, temper down the itching and scratching. The second thing, because it's an allergic response and we're dealing with the lymphatics, is we want something to reduce the toxin. So I would use a product called wind toxin at about a quarter teaspoon twice a day for 3 weeks. And finally, we need to rebalance these weak and stress points. And so I'm going to use a product called Drain Par, and we're going to focus and fuse it specifically for circulation, skin, endocrine, and lymphatics. And we're going to put this patient on 2 drops a day for 3 months and retest. The idea is that we're going to rebalance the root cause, improve the pattern, and reduce the symptoms. And the cool thing is that we want this patient to be doing it on its own so we get a cure or at least a long-term recovery.
So explain a little bit of how you've got the endocrine controls here.
Well, the endocrine control, it basically up here is we're dealing with the circulation center, which is the heart and small intestine in this diagram. And the endocrine system controls this and improves circulation and improves lymphatics. And when we have weakness, then we see that we come down along these 2 lines and start to see imbalance. And if we don't have good control here, this controls the lung, large intestine, and respiratory tract, which the skin is related to. And if we don't have good control here, then the outpoint is going to be the skin, which then will get symptoms over here. And this is the itching and the scratching coming out through that end. The treatment is we're going to balance endocrine, we're going to reinfuse the Drain Par, and we're going to focus on the endocrine system because we want to see this under control. So then by step we get these other things back into balance again.
Now, one of the things that's interesting is people will often immediately think my pet has an allergy because it's itching. But that's not necessarily the case.
That's not necessarily the case because we do test for 2 allergy points, and those 2 allergy points in this patient were balanced. So even though the dogs or cats are itching or any patient is scratching, it doesn't mean they have allergies. You have to look to the root, to the imbalance in order to get the answers you're looking for. Because skin disease is a very chronic problem. And so most of the time it's chronic because we're not at the root or the source point of where it's coming from.